Oh, hi.
I was kissing the camera.
Oh, you're kissing the camera. I'm Brad. I'm from EMS Tactical Group, and going to go over some med kit options for concealed carry, for range use, possibly for professional use if you're like myself as a paramedic and a tactical medical trainer.
Mr. Andy here. I'm going to be helping out Brad. I brought some of my own homemade medical kits. We have some pre-built medical kits, and we'll go over them for you.
Start with this one?
Let's start with a biggie.
Let's start with the biggie. So this is actually a pre-built. When I say pre-built, we mean from a manufacturer, comes kitted out with all the components in it as opposed to just buying a bag and putting the stuff in yourself. This one is actually from North American Rescue. It's their Storm. It is designed more specifically for a tactical paramedic or a rescue task force paramedic, whereas it has a needle for chest decompression and it's got a nasal airway. And
Now, a lot of people are just buying these and not knowing how to use it, but saying, well, someone there will probably know how to use it.
Right, of course.
Which is not a bad thing.
No, it's not. I mean, honestly, if you were going to buy this kit or a kit like this pre-made, I would say if it comes with a chest needle, though, you probably might be in your best interest to pull that. I would love to. It goes in your left eye, I believe, is where it should go. I'm not sure. No, it does not. So that's an example. It comes with, it's got a tourniquet, a cat tourniquet. We'll go over some tourniquet stuff. Got a couple of Israeli dressings or combat dressings, a couple of chest seals, and it's actually got a tactical combat casualty card and a nifty little Sharpie. And it comes in a nice little pouch with a drop rig that goes on your
how much does one of that cost?
Some gloves.
Approximately.
I think this was issued to me by my agency. I think these are like $90 or $85 a piece. They're a little pricey, but it's an awesome bag.
I think it's more than that.
It's a really okay. I'm not.
I mean, full. It was stocked full.
Maybe it wasn't. Maybe it was a little more. I'm not sure, but it's it's pricey anyway.
Generally, when you build your own kits, it's generally cheaper than building something where the full kit that you get.
Yeah, absolutely, sure.
But buying a full kit, you're guaranteed to get the right stuff.
Right. Well, you can also confer with somebody who either knows what they're talking about or sort of knows what they're talking about, and they can kind of point you in the right direction. So, and you can still get the right stuff. Bottom line is, I would say probably you're going to save 20 or 30% doing it yourself. It seems to be, don't quote me exactly on that, but that's what it seems to be.
What else you got?
What else do I have? So this is my range belt that I wear. I have a this is a cat tourniquet with a Kydex holder. That is also, I purchased that through North American Rescue. Real cat tourniquets, the best place to get them, in my opinion, is through North American Rescue. You got to be careful if you buy cats on the internet because there's some phonies out there. And then on this is just a Condor pouch. I think I picked up from Optics Planet for, I don't know, $15 maybe. And then I stocked it myself. I just have some 2-inch roller gauze in here, an Israeli dressing, some 4x4 bandages, another tourniquet, Band-Aids, lots of Band-Aids, and some bacitracin or antibiotic ointment. So you're on the range, how many people pinch a finger, cut themselves little, whatever? Band-Aids are great to have.
If you're not bleeding, you're not working, right?
Yeah, exactly. That's what happens every time I'm working on my truck. My knuckles bleed. I'll just take everything out of here, throw it all in a big pile. A couple more, these are, what is this? Cheeto gauze. Cheeto gauze is basically, it's gauze with a hemostatic agent in it, so it induces blood clotting.
It's a quick clot.
Quick clot. Don't spend your money on quick clot or anything like this, because any of the combat gauze and things like that, a lot of it comes with some of it impregnated. So don't buy the powder that you pour on. That's my recommendation. You don't need it, because a lot of the products come with it in it, and honestly, it's way too expensive.
It is expensive, and for a budget kit, all you need is your 2-inch. Where's your 2-inch roll? Just a regular, yeah.
Go 2-inch and then 2-inch for wound packing. Sure.
For wound packing, you don't really need all the expensive $30 bag of the quick clot. One of these, just pack it with one of these. It will do 99% of what the quick clot does. Some
5x9s, which are basically just trauma dressings. And then, of course, chest seals. I have chest seals. You should probably, if you learn how to use a chest seal, if you take the time to learn how to use a chest seal, take a class, not necessarily watch it on YouTube. I would recommend a chest seal. Now, granted, a lot of this stuff I just picked up from work. I'm a practicing paramedic, so I just grabbed a couple of things out of our supply room because, I mean, this stuff is dirt cheap for us. So I would say a kit like this put together, you could probably put this kit together. The most expensive thing in here is probably your cat tourniquet, which is anywhere from 25 to like $35,
Yeah,
depending where you're going. I would say this kit here is probably 45, probably like 60 bucks is what it probably would cost to put this kit together. So, and you know, gloves.
So that's
black
a night,
gloves.
That's a night out drinking, right?
Yeah, pretty much.
So
Let me talk about
drinking.
gloves real quick too. These are black gloves. For what we do, black gloves are terrible. Terrible. Do you know why they're terrible, Mr. Ian?
No, I don't.
What can you not see well with black gloves?
Liquids.
Liquids, blood. You cannot, it's hard when you do a blood sweep or you're trying to check for blood on a patient. Black gloves are terrible. Unfortunately,
But they're tactical.
They're tactical and they look cool. And unfortunately, my agency only carries black gloves, so they're kind of my glove supply. So that's why I have black gloves. So do as I say, not as I do. I have no idea what he's got in his stuff, but I'm really interested in seeing because it looks pretty cool.
Just a couple of things that I brought. This is one of my range bags. It carries my everyday range bag, basically, with some tools. But right in the top here, I have a little, what are those things called? The EMS crosses?
Star of Life.
The Star of Life, whatever.
Yes.
So, indicating that's where I keep all my medical stuff. In this one, this is a quick one. I just have the SWAT tourniquet. These are really easy to use. If you look at them, the directions are printed every 6 inches on them. Basically, you have a circle, you want it to make it, or you have an oval, you want it to make it look like a circle, and you have these squares, you want it to make it look like these. So you basically pull it as tight as you can there, and they match. See, now it's an oval. And you just wrap that around and tuck it in.
And it says SWAT, so it's got to be cool. I mean, it's tactical. SWAT.
This isn't something that I would use on myself, generally.
What would you use?
I would use a cat tourniquet. I carry cat tourniquets. I carry 2 other cat tourniquets for me. I carry some other kind of tourniquets for other people. It's just harder. I mean, putting this on your arm, it's possible, but when you're injured trying to do it with this, I would say it's not the easiest. It can be done with practice, lots of practice. Gloves. I have
color.
Non-black gloves.
Yep. We're losing Band-Aids all over the place here.
I have my pressure dressing. That's it. That's all you carry.
That's
in this
all
one.
you really need. Really.
I have a couple Band-Aids in the other spot, but just these 2 things here is
when you're shooting. I mean, the biggest
just about it.
Your biggest concern, life threat, is going to be hemorrhaging. So you want to be able to control hemorrhaging, and that kit right there controls hemorrhaging.
If I need a quick chest seal, take this out, and I use this packaging as a chest seal if I had to. 2 more other kits. This one, I'm not sure where I got this one. I've had this one a long time. This one actually goes on my belt like his. I think it's an early ITS tactical, but I'm not sure. If not, they make excellent kits right now.
Love Brian's stuff.
They start around 75 bucks and go to like 150 bucks, but really top quality stuff. Check them out. I have a SWAT tourniquet. I have Israeli dressing, chest seal, more pressure dressing looks like, and airways.
Now, is that a SWAT tourniquet?
Oh no,
or is that a
soft T.
Soft T.
Soft T.
Tourniquet, yes.
You can tell by that metal clip.
Yep.
Basically.
And the triangle is the other way to. Similar to the cat, but yet different.
Different. Better for, say, legs.
Yep.
People say.
I think so. Sure.
And this is a Mars Tactical. I got this last year. It also comes with a carrier that you can has Molly, but this is one I usually just throw in one of my bags because it's very portable. Just throw it around. And this in here, I have the very controversial rat tourniquet. If you get whatever tourniquet you get, practice with it.
Right.
Don't just buy it and put it away and say, I'm going to use it.
And honestly, any tourniquet is better than no tourniquet.
Yes.
And don't be like, oh, I wear a belt, so there's a tourniquet, because that's a very ineffective tourniquet.
Would I say if you're only going to have one tourniquet to buy this one? I would say no. That would be my advice. But I've bought lots of them, trying them. This one stays in this one. I would absolutely use this on someone else. If you train with these, if you buy a trainer and use it, make sure you have a partner to take it off, because once it's on, sometimes you can't take it off yourself. So don't train with this alone. I had to go to my daughter once and say, honey, can you get this off? And It's a little embarrassing, but you know, it happens.
Sure.
In here I do have,
See that.
I got this for Christmas. This is the quick clot we're talking about. I think these are like, it's almost 20 bucks for this.
Yeah, it's expensive.
You can get these in Dick's, Field and Stream, places like that if you want, but you really don't need it. Gauze will work just as well, trust me.
How's Amazon for supplies? I've never really looked. I know you're a big Amazon guy. And can you get stuff like this on Amazon?
Absolutely.
And with Prime, right? It's
With
probably...
Prime, 2 days you'll have it, free shipping. Price is comparable, but you do have to be careful with tourniquets. There are fake ones on Amazon also.
Right.
They call them airsoft tourniquets.
Mm-hmm.
It's basically costume jewelry. They're not made to stand up to what these are made to stand up
Yeah, and
to.
I think at some point maybe we'll do a video and talk about tourniquets and compare them. And
Are we gonna buy some?
How you? Well, I'm not gonna buy any, but if you want to buy
They're
me
like
some tourniquets,
$8.
No, not fake tourniquets.
Yeah, we got to buy a couple fake ones
Well,
to
we
show
can buy
it.
fake ones to show the real ones. So,
But the common denominator in all these is, I think there's a pressure dressing in everyone,
Yep.
either an H or an Israeli.
Yep.
And a tourniquet. So those two things, without those two things, I think you'd be screwed.
Yep. And grab your pressure dressing for a second, just so I can. So, pressure dressing completely sealed up in a package. That's what it is. And once you unpackage it, it actually turns into this. So you're getting a ton for your money. And while I got it out, I'll just unravel it real quick. But as you can see, it comes with a nice pad and gauze and stretchy stuff. And for
The only thing we
video.
don't have are tampons.
No, we don't use tampons anymore. We don't recommend them. It sounds funny, but there was a point where packing a wound with a tampon was a good idea. Believe it or not, the state I practice in, we still have to carry maxi pads on the trucks for bleeding control. So I think that's it. That's all I got.
That's all I got. It's a
Thanks,
lot of
guys.
stuff.
Hopefully we answered a couple of questions and didn't look like
Oh, you did.
we're completely, yeah, well, I do, but whatever.
All right. Thank you.
See ya.